Now, as you may remember, we chatted earlier on the show to a young medical doctor that's doing some great work in educating people about cancer in KwaZulu-Natal. But of course, this is not something that's just affecting residents and people in KwaZulu-Natal. It is a global problem, but more importantly, let's focus in on South Africa. And we're going to continue this topic when we are now joined by our very own First Lady, Thobeka Madiba-Zuma, who is in studio with us on this World Cancer Day. It's so good to have you in studio, First Lady. Thank you very much for taking the time to be with us.
Thank you so much, my dear, and greetings to the viewers at home.
First Lady, why this particular cause? What is it about cancer that really resonates with you?
I think for me, in 2009, I came to a very harsh realization that cancer was not getting the attention it deserved. Well, it's even worse that it's given fancy names, that it's a chronic illness, it's a lifestyle disease, when it's a silent killer. So it was important for me to give it the face, but also not only giving it the face, to highlight the risk the risk factors that would place your life at risk of getting the disease. And also to educate our people, because I realized that the reason why so many of our people were dying was not because of the disease itself, but was because of the lack of information, the lack of awareness about the disease. So they were carrying on doing things that were placing their lives at risk of getting cancer. So I decided to give it the face, but also to advocate, and influence policy using my position, which I always refer to it as a unique position of influence, not of power, of influence, because I sit next to the executive seat of power every day. So how else could I use that position of influence to championing the issues that are affecting our women and their health as well?
Yeah, I mean, one thing about cancer is it knows no boundaries.
No, it doesn't.
Everybody is at risk of getting cancer, and that is it's a major issue, and it needs to be focused on as much as possible. In terms of some of the work that you're doing around the country, what is it? Talk to us about that.
Early on, I realized that one had to start on raising our health literacy through education. Educating our people, especially paying particular focus in the rural areas where there's lack of access to information and lack of access to screening services as well. So for me, it was a tripartite alliance of educating, screening, and ensuring that people have got access to quality treatment as well. So the work that I do, revolves around educating our people so that they take charge of their lives, because as much as the government is the custodian of its own people, but we still need to have responsible citizens that are not dependent on government, that I can just live my life anyhow I want to, but when I get sick, I'll go to hospital. We had to change the mindsets of our people to say that you need to take charge of your life, and ensuring that you eat healthy, you exercise. We need to deal with obesity. We also need to deal with alcohol abuse. We need to deal with issues like smoking, and all these issues that I'm mentioning, they place the lives of risk of our people to get the disease. So we needed to ensure that our people are empowered with the knowledge on how they can also behave in a manner that is responsible. But also what my foundation is focusing on, Leanne, is strengthening prevention. Because I realize that we can build as many hospitals in our country as possible. But if we don't strengthen our preventative methods and ensure that we invest in preventing the disease, the onset of the disease, then we would be fighting a losing battle, because we would then because getting sick and hospitalized is the end of the stick. But the importance is ensuring that we prevent the onset of the disease. But having said that, we need to be balanced in the manner which one does this, in ensuring as well that we call on industry to say, industry, you also need to take responsibility. You can't mislead our people by falsely advertising and misleading them that it's cool to drink and abuse alcohol, that it's cool to smoke when there's no benefit in smoking. So we needed to take a balanced view in doing so. But over and above education, it's ensuring that there's equitable access to healthcare.
Yeah.
Ensuring that our government as well creates access, regardless of where you are in our country, you still need to have access to screening services so that we save the lives of our people, because we know that cancer is only dependent on early detection. That's the only way we can save the lives of our people, when we detect it early and we also prevent the onset of the disease.
Yeah.
But even those that are diagnosed, that they are supported by the system, our healthcare system, they are put on treatment on time.
That's the big thing. And you know, we talk about these healthy lifestyles, which I know we're trying to advocate. I mean, and you see in cities, people do try. I mean, you see people out on the road cycling early, getting to work. There are gyms at work, and you try and get that message, which it's surrounding you all the time. However, when you go out into the remote rural areas, it's a different story altogether.
Absolutely.
And as you're speaking here, it is about regular testing, detecting it earlier, and yet the facilities to get to a clinic are so far. The lady we were talking to earlier, who was based in KwaZulu-Natal, is wanting to develop a mobile clinic to go out into these areas with young doctors to try and test. How do we get there? How do we try and get into these rural areas in South Africa where, you know, it's almost like they have no chance if they do not detect early?
I think for me, Leanne, I've been calling on our citizens to say, those that are in the cancer landscape, can we join forces, work as a collective? I know it has been difficult to attract funding, but if we work as a collective with the non-governmental organizations as well, we join forces, because we know that government cannot do it alone. But to assist the government of the day, how can we respond to the challenge posed by the disease? But for me, it's ensuring that we raise as much funding and resources as possible in order for us to be able to even afford getting those mobile events going into the remote areas of our country and the deep rural parts of our country where access is very limited. But there's so many gaps in our healthcare system where my foundation fits in, because we didn't want to reinvent the wheel. We wanted to close the existing gaps that are there. And one of them is definitely the mobile clinics where you take the services to the people. But the most recent project that we've successfully done and completed was to build a clinic in the most rural parts of our country. It's called Mangleli Clinic, which we will be handing over to the government. But it's also through public-private partnerships, calling on the private sector to also play their part in ensuring that they contribute towards the well-being of the population, because in turn, they're also going to benefit. Their profits and the bottom line of their profits, they will benefit when they've got a healthy working population, as opposed to people staying at home sick. But in the rural areas, I agree with you, so much of work still needs to be done in ensuring that we take the services to our people and we ensure that our people have got access to healthcare. But over and above that, I always add another component, which for me, I feel is important, is the retraining of our health workers in the deep rural parts of our country, that they also change their mindset in ensuring that even when they do have at their disposal those screening services, when people ask for them, they shouldn't have an attitude and think, but you're not sick, there's nothing wrong with you. That mindset has to change to say, let's prevent the onset. Let us not miss the opportunities to screen our people. When a woman comes for their prenatal care in their clinics, they need to check for other things, the non-communicable diseases, your hypertension that places their life at risk of even the child that is not born yet, your cancer, cervical cancer, all the other opportunities of screening should not be missed. And our clinics, I'm happy that our Minister Motsoaledi, is going through what they term a primary healthcare re-engineering, whereby in the district level you would get specialists, so we would be able to, the referral is going to improve, and so many other things and other problems that exist in our clinics in the rural areas, I think, are going to be addressed.
Is there a website? Because I know we've got a lot of people that are watching. They would love to know the work that you're doing, where you're working predominantly, and also if they can help. How do we get in touch with you?
Certainly. My foundation is a national one. We're not only focusing in one province or one part of our country. And it's at www.tmzfoundation.co.za.
Okay.
And we've got a Facebook page as well, which is called TMZ Foundation. And my handle on Instagram, it's First Lady T Zuma, where we also show the work that we do, where we connect, taking advantage of social media, because social media is very cheap to connect. You can connect to millions of people at a cost-effective manner. And we use social media a lot to communicate, especially with the youth, because that's where we need to invest, a lot of our energy in ensuring that our youth take charge of their lives and they act responsibly, and those that are at varsity for the first time, they don't get overwhelmed by this freedom that they suddenly have and start abusing alcohol and smoking and everything else.
And you're also a living example of it, because let's not kid. Look how amazing you're looking.
Thank you.
You talk about advocating healthy lifestyles. I know we have to wrap. I promise you I'm going to wrap now, but I cannot end this interview without asking you. I mean, 30 kilos, is that how much you lost last year? How do you do something like that? Because a lot of people want to do that. People want to live this healthy lifestyle, but it's difficult. And people talk about it, but you're living it. So what is it that you changed in your life?
Yes, I think for me it was a decision that I took when I approached 40. And I realized that, being obese, it's not healthy. It was placing my life at risk. It was not about looking good, it was about my health. And I decided to do it the healthy way. And I always advise people wherever I do health education that you need to ensure that you go to the doctor and you don't follow these misleading adverts of crash diets, of eating cornflakes or brain flakes every day and not eat healthy. It's about eating healthy, and it's thinking pink and eating green, ensuring that I don't eat those ridiculous things I eat, but everything should be in moderation and balanced. Even when you feel like you're craving for something that is outside, your eating plan, you still need to do it in moderation, in a manner that's not going to place you at getting back to the bigger size that you wear. So that is how I've kept the weight off. And for me, I believe in leading by example as well, because when I say to people they must eat healthy and they must shed off those extra kilos, it's something that I've done. It's doable, it's possible.
Well, you look amazing, it's inspiring, it really is. And it's so nice to, you talk about something, but to do it is another issue.
Absolutely.
And you must feel better, and that's the main thing.
Absolutely. And I'm also going to call on South Africans that on the 28th of February, we're going to be in the Union Buildings wrapping up the month of Feb, because for us, the celebrations of the World Cancer Day do not end today, they go beyond. So on the 28th of February, we're going to be in the Union Buildings lawn, and we're going to have that massive walk where it's warriors walking for cancer.
Fantastic.
And we acknowledge those people that have survived, but also thinking about those that lost the battle to the disease.
All right. Thank you so much for joining us here on the program.
Thank you.
The First Lady here in South Africa, Ms. Thobeka Madiba-Zuma, thank you very, very much for being with us and talking to us about World Cancer Day, an initiative that she supports very, very much so.